First thing I would like to take your attention. This presentation and the paper that is being sent for publishing is the fruit of a collaboration between Brenda and myself. A study we did in Spain, and then Brenda came and helped into the analysis and into the discussion of the findings. So something that I would like you to pay attention to this, that we can collaborate whatever, how far we are apart, with no big monies, but we can still do things. Now, this study, I will give you a few data about Spain and caregivers. The first important thing is that over the past 20 years, nothing has changed about caregiving figures in Spain. There's still women who are the main caregivers, 84% of the population. They are housewives, in theory available to care for their relatives. Their age mean is 52 years old, but we are getting caregivers older. 20% are plus 60 years. It's been told that in Spain we have this model of Mediterranean culture where women is in the center of the care within the family, and they are the providers of the welfare for the family. I must say that it's a very convenient culture for the state. They don't need to put services. Women does it. It's the ideal of the family. Things are fine, so why to bother? That's why figures have not changed for the past 20 years. Over the last 2 decades, there has been an increase of the people who need support because they become elderly, they live longer with chronic diseases. There are insufficient formal services. This is chronic in Spain. There are women who are entering the job market, meaning they are not really available to give care for their relatives. And we have a very inflexible labor market. These part-time things, they are not really there. So there are not room for people to combine duties, family duties and the duties to their relatives. What is happening in Spain, and is happening in the United States, I don't know whether it's the case here in the United Kingdom, that in the caring sector there's been a deficit or a void. There is more demand than supply. One way to cope with this demand is been hiring migrant caregivers. This has been a new phenomenon in Spain. The migrant caregivers are 43% of the paid caregivers. Since the 1980s, huge flows of mostly women from Latin American countries came to Spain. Spain in the 1980s and 1990s, we were a rich country. The economy was blooming, this housing bubble. So there was a lot of demand for labor, cheap labor. In Madrid, for instance, 90% of the caregivers of older adults were migrants. They usually live as living caregivers. They have contracts as domestic employers. And a very important number of that figures are illegal, meaning they are forced to live in a very exploitative conditions. This study looked into respite, not so much into the burden of care, but what people do on everyday life to alleviate the burden of care. The literature has shown that respite can be a service and can be an experience. And this study looks into the experience of feeling relief of the burden of care. In the case of the migrants caregivers, the migrants are considered the respite of the family caregivers. And in terms of burden, they are more vulnerable. They have very poor working conditions. They are separated from their families, from their networks. And adapting to the host country is stressful and because of their acculturation, and they develop more diseases. They have more negative effects. So this study, what we did is to contrast what family caregivers did to alleviate the burden of care. That was one part of a major study, and what migrant caregivers did to alleviate the burden of care. The method was a qualitative research study using grounded theory, constructivist grounded theory, which is a branch of grounded theory. And participants were 23 family caregivers, 17 migrant caregivers. We did interviews, semi-structured, written accounts, and as well a meeting for evaluation. And in this study we are presenting now, what we did was to compare what caregivers, family caregivers did to alleviate the burden of care and what migrant caregivers did. The two previous studies show that family caregivers, the general strategy they used to alleviate the burden of care was something we call to live the life of caregiving. It's not about going places, but to be able to live a life. And migrant caregivers' strategies were turning to one's own world. The first finding, which is in grounded theory is not surprising, is both strategies are context-bound. So we have to look first what is the context of each group to understand a bit the strategies. For family caregivers, we found that there was an after and before in the experience of caregiving. Their lives suffered a total change. During the interviews, they all the time said, well, before things were in that way, now things are in this way. The common theme that came across the analysis, it was that their life was not normal. They did not live a normal life. They have no time for themselves, they have no space to be themselves, and the caregiving demanded of them increasing renunciation. So the idea was that for caregivers, the context was that of a restricted life, no life of their own, and they were living in an altered life. Here, which is typical of qualitative studies, you have Maria saying, I did not go out anymore, the disease develops so quickly, and then you do not have a life of your own. I will go out to have coffee, but not going out with my friends or go for a trip with them or with my boyfriend, or say, I'm going to do a normal life. No, I have to restrict myself. So that was the idea of the general context for family caregivers, no normal life, this altered life. Migrant caregivers, they live in a country. This country is not their own country. They are away from their families. They are separated from what they belong to them, and their life is dislocated. It's not altered, but has moved, is dislocated. The general context for these migrant caregivers was frustrated expectations. They came to Spain hoping to have good jobs, good salaries, decent working conditions, and that was not the case. So they see the everyday life as a life with no options. They felt trapped. They felt physically and emotionally trapped, and they have to endure with this situation. And on top of that, they had a very bad job. Edith says, one comes with aims and plans drawn, but you will not believe it, I have not been able to meet them yet. And Edith was in Spain for 3 years and not able to do their targets. Contrasting what migrant caregivers did to relieve the burden of care and family caregivers did, we found different strategies, issues in common. And it's typical in grounded theory that you compare, and by comparing, a core category came, and the core category we name it distancing oneself from a caregiving identity. Because the issue all the time is not what you do, whether you care or whether you clean your house, but how you feel you are, what is your identity. Now, so you have here on top the general strategy for family caregivers, the general strategy for migrant caregivers, and then the tactics or the strategies they use. So we compare those two, connecting with one's life, virtual outings, going to private places, building moments in life of common, making those they care for their own, keeping in touch with caregiving, and deciding to go home. Those were the results of the previous two studies. So now we are contrasting them. We found that distancing oneself from a caregiving identity was the central issue, and we're going to look at each group. Family caregivers, we found that they used two strategies that they really were efficient for them to relieve the burden of care. One was connecting with one's own life. For example, they were saying that they were feeling relaxed and relieved when they were caring for their own grandchildren, when they were staying in privacy with their husband, when they were staying with friends. And one participant said, when we are others, Carmen, I mean, when I'm a different person, I can't relax and I don't feel the burden. As well, caregivers were able to these caregivers were caregivers of relatives with advanced dementia. And they were able to relieve the burden of care when they connect with the patients, but not as a patient, but as a relative, my husband, my mother, and they create these moments of being kin in common, and these moments were moments that for the caregiver relieve the burden of care. So what we found is that really the burden of care is relieved in these cases when they take on other identities, housewife, wife, sister, friend, whatever. In the case of family caregivers, some of these identities were postponed. I mean, I cannot be your mother now, you have to go, you have to go on your own to do the shopping, I have to stay with grandmother, for instance, we'll do it some other day. So some identities were postponed, but other identities were completely lost. They lost friends, they lost the connections with relatives, and they feel they could not take this identity. So what we found is that these caregivers rest when they really relate in different manners from that of caregiver, which were not so much about going out to places to relax, but it was about relating in different manners to others. And here is a caregiver who says, the way I clear my head is by going to my home and organizing things at home. And she laughed. It's not time for myself, but it's time for my home. So she's doing something different, so meaning she's being something different. She's being someone else. It's time for my daughters and for my husband, and she laughs. But time in inverted commas, as neither my daughters nor my husband are at home at this time of the day. So Veronica is at home on her own, but she's doing different things from that of caregiving of the sick relatives. She's organizing the home. She's taking other identities. Migrant caregivers, we found that they rest when they return to preserve identities and places. And one thing very important for migrant caregivers were virtual outings. And the virtual outings, I'll show you in a minute, mean going to the locutorios. The locutorios are places, hubs, communications places, where they can interact with their children via internet, celebrate birthdays, see all the family. See, in one here, you have the internet connections, and here are the phones. So they can make phones for very cheap money, and they became mothers, wives. They connect with these other identities. So the virtual outings, meaning going this place, were really true break moments for migrant caregivers. When they could not go out to these places to make phones or to send money or to see their children, they retired to places of their own. They have shared flats when they go over the weekends, or even they just retire to their own bedroom and they relate to the interviews that they were thinking on their children. So they recreate in their imaginations relations. So as well, some of them decide to return to their own countries for short visits, and for them, these were really the true breaks. So what we found is the break was from being a migrant caregiver. So that's the true break. It's not about doing nothing physically, but it's about being someone different. So here is one. Laura said, speak on the phone with my husband, with my children. In this way, I return, meaning return to her work happy. This is the way I do to breathe a little, and this keeps me alive to carry on. So these places are really important places for migrant caregivers to achieve rest. We found, nevertheless, false exits, meaning that people were trying to do things to relax, but they were not relaxed, they were more burdened. And to be very short, family caregivers, they kept in touch with caregiving when they go out for walks or for trips, and they remain connected, and they remain with a cell phone connected, wondering what is going on back home, what is happening. So they were not able to relax, they were not able to disconnect. In spite of being away, they were still worrying and wondering. As well, caregivers were going out to workshops to visit other caregivers. There were outings, but they were still connected with caregiving, which was not really true breaks. So they didn't have no one to relate in a different manner but that of caregiving. They were all the time in this caregiving world. Migrant caregivers, they were building in their working place new homes and families, but these new homes were fictitious identities. And these identities kept the migrant caregiver connected to the job because they were as if fictitious. It was the daughter and he was my grandparents. But the relationship they established is that of caregiving. It was for caregiving matters that these migrant caregivers were treated as daughters or as grandchildren, not for other matters. So that would add burden. The study, to sum up, has showed that for caregiving to rest, they need to distance from a caregiving identity. It's not, again, about going places or doing nothing. It's about doing something different than caregiving and relating to other people in different manners. So it reveals that caregivers, they need to have other selves, alternative selves, to be able to be someone else. If they are isolated, if they don't have anyone to relate with, I remember a caregiver said to me, Carmen, I'll go out to the shops, but I have no one to talk to, I have no one to relate, and I go back home as tired as always, because there is no one to relate in a different manner. What we thought is that we have health and social care professionals promote leisure activities for caregivers, and as well involvement in different roles, but different roles from that of caregiving. Otherwise, they will continue suffering this burden. As well, we have to raise awareness, and in Spain, of caregivers' needs for rest, migrant caregivers. And lastly, we have to pay much attention to those strategies that we think that they provide rest for caregivers, and they in fact add burden because they don't distance from these identities. Well, thank you very much for your attention, and this is Alicante.